wish you happy Hunger Games.
I'm proud to be here with my fellow colleagues on the House Budget Committee. They've worked very hard, we have together, to produce this document, The Path to Prosperity.
Between 8 and 10 million people will be kicked off of food stamps.
Food stamps terminated.
Do you acknowledge that poor people will suffer?
No. You called your plan thinly veiled social Darwinism.
I know what it's like to go hungry. I've done it for a whole weekend so that my child could eat. So I lived on student loans, credit cards, and the grace of God for over a year and a half trying to figure out how to feed my son.
The food stamp program helps give my daughter the extra assistance that she needs.
And when those things changed, I was able to receive food stamps.
And I was having this conversation with a woman, and she is only eating once a day so she can save the calories for her husband who's actually employed.
Seneca, why do you think we have a winner? Hope.
Free enterprise, self-determination. I'm just a glass half full kind of a person.
A little hope is effective.
We don't want to turn the safety net into a hammock. We know what works. Limited government works.
I just can't afford to think like that.
A lot of hope is dangerous. The spark is fine, as long as it's contained. Contain it.
And we're ready.
When there is no infrastructure in place to protect people,
Take care of them, get whatever you do, don't let them starve.
these programs are providing the bridge that's keeping them from abject poverty.
You're stronger than they are. You are.
What did you say to your sister when you volunteered at the reaping?
I told her that I would try to win for her.
And try you will.
So I ask that if you're looking at cutting programs, that you don't take it from the most needy and those that are most needing of these services.
You can't mess with food stamps.
Hello and welcome to Media Watch on Hunger and Poverty. I'm your host, Bill Schickler, and today we're very fortunate to have as our guest someone who has been a public figure involved in informing people of their rights, involved in civil rights struggles, in organizing working people, in working on the environment, and most recently working on health issues. He is now the executive director of an organization called Healthcare Now, and I'm talking about Sam Jordan. Sam Jordan, welcome to the program.
Bill, thank you so much.
Sam has been on the show before with another icon of the Washington area, a guy by the name of A.C. Byrd, who unfortunately passed away several years ago, who was also a civil rights organizer and was one of the organizers of the Freedom Rides of the early 60s. And if you ever watch Eyes on the Prize, you saw the work of A.C. Byrd, and his work continued throughout the years, also with radio station WPFW, where he was a member of the board for a long time. So Sam, maybe you could tell us a little bit about the organization that you are now executive director of, Healthcare Now.
Bill, Healthcare Now has been a long-term community health advocacy. Our slogan has been, healthcare is a human right, since 1996. And we've advocated and promoted a number of issues that sought to make healthcare affordable, good quality, and available without regard to anyone's ability to pay. And today, we're speaking and addressing an issue that has been slowly percolating in the news, not quite yet in the full news cycle, but is one that has been contentious for over a decade. And that's the matter of CareFirst Blue Cross Blue Shield complying with its congressional charter. The congressional charter requires that the organization act as a charitable and benevolent institution. They haven't quite done so. On December 30th of last year, 2014, DC's Commissioner for Insurance, Mr. Chester McPherson, ordered CareFirst Blue Cross Blue Shield to distribute what had been determined as $268 million in surplus reserves. That money is to be distributed in Maryland, Virginia, and the district. CareFirst has yet to comply. So we have on the line with us Walter Smith, the executive director of the Appleseed Foundation in Washington, D.C. Appleseed is more than 2-decade fighter, and I can say a champion, on matters affecting D.C. residents, in fact, area residents. It's one of the number of organizations inspired by Ralph Nader. But without taking too much in the introductory phase, I'd like to introduce Walter Smith, Executive Director of Appleseed Foundation, and talk to us about that December 30th, 2014 order by our commissioner to CareFirst to begin distributing its surpluses. Walter, how are you doing?
I'm doing well. Thanks
Walter,
a lot,
thank you
Sam.
for joining us. We'd like to go directly in the time we have left to talk about that order, December 30th, its origin. Where did it come from, and where are we now with CareFirst compliance?
Well, this is, as you say, Sam, an issue that's been percolating for quite some time. A lot of people in the district in Maryland, Virginia have believed for a long time that CareFirst Blue Cross Blue Shield, which is by far the largest health insurance company in the region, has not been meeting its not-for-profit mission. And because of that, the D.C. Council in Washington, D.C. passed a law in 2008 instructing the D.C. Insurance Commissioner to hold a hearing and determine whether or not the company, in fact, has excess surplus that ought to be spent down to benefit subscribers and members of the public.
Walter, can you tell us how a surplus is determined? I'm certain that our listeners and viewers don't quite expect companies like CareFirst Blue Cross Blue Shield to be operating with surpluses, particularly excess surpluses. How is that determination made?
Well, the determination is made by actuarial experts who determine how much an insurance company like CareFirst needs to be sure that it can be financially sound and meet all of its claims and still have money as a backup in a surplus account in case any number of unexpected contingencies occur. It is possible through actuarial experts to determine what the level of surplus ought to be. And that's what the insurance commissioner did, following normal rules that are set by the National Association of Insurance Commissioners. And as you say, Sam, the commissioner determined late last December that the company had $268 million in excessive surplus. And you need to understand what that means is they first set aside a reserve to meet all claims. Then they have a 10% leeway above that in the reserve account. Then they have, separate from that, a surplus account. And what the commissioner determined was that because that surplus account had almost $1 billion in it, beyond what it had set aside to meet claims, the $268 million was way more than enough to maintain the financial soundness of the company.
Now, Walter, when the commissioner, Chester McPherson here in Washington, D.C., determines that CareFirst has a surplus and orders CareFirst to distribute that surplus, for what purposes can and should that surplus be distributed, and how has CareFirst responded?
Well, under the D.C. law that governs the company, and I should say we're talking about the D.C.-based portion that is affiliated with CareFirst. We're not talking about all of CareFirst. We're not talking about some parts of Maryland. We're talking about only a company called GHMSI. But the insurance commissioner, in fact, determined that the part of the surplus attributable to the District of Columbia out of the $268 million needed to be spent down. And under the D.C. law, the company in the first instance had an opportunity to file a plan with him on March the 16th, saying how they propose to spend it down. And under the law, the spend down could be for any number of a combination of things. Some could be used for premium reduction. Some could be used to support nonprofits who are working on healthcare issues. Some could be used to actually build clinics or hospitals or to conduct public education campaigns related to health. So the money could be used for any number of things. And to answer your second question, to a lot of people's surprise, on March 16th, which was the day that the spend down plan from the company was due to be filed with the insurance commissioner, what the company did, instead of outlining how they proposed to spend the money down, they filed a document in which they told the commissioner that they disagreed with his order concerning the need to spend down money, and then said they had reviewed their books and determined that, in fact, they had already spent down all $56 million that he had ordered them to file the plan about.
I want to summarize that point, Walter, for our listeners. CareFirst Blue Cross Blue Shield was ordered after a lawful, strenuous exercise by our commissioner, Chester McPherson, of the Department of Insurance, Securities, and Banking, who found that with all the actuarial studies, CareFirst had excessive surplus of $268 million, and lawfully ordered CareFirst, as according to the law, to spend that money down, that is, to distribute it in the jurisdiction served by CareFirst, and ordered CareFirst to submit a plan on March 16th as to how that money would be distributed or spent down. And you're saying that CareFirst submitted a document letting our commissioner know that they had already spent down the $56 million attributed to Washington, D.C.
That's right. That's what they said. Now, we believe they're wrong, and we submitted a document to the insurance commissioner just a few days ago, urging him to determine that CareFirst is actually has acted in defiance and in disobedience of his order. And for that reason, we believe under the statute, the commissioner can and should now proceed to develop his own spend-down plan. He always had the ultimate authority to determine whether or not their proposed plan was fair and equitable. But now that they have declined to submit a proposed plan, we're hoping that what he's going to do is develop the plan himself.
Walter, we were asking if this will stimulate or trigger a tripartite three-jurisdiction dispute over the commissioner's order, or how do you see the jurisdictions working out their varying perspectives on this order? We want to always get back to the use that can be made of these funds, but the jurisdictions have in some way to be in accord.
Well, right, it's a good question, and right now we don't know for sure. The important thing, though, for people to know is that after the D.C. commissioner released his opinion at the end of December of last year, the insurance commissioners both in Maryland and Virginia initiated new surplus reviews of their own, both to determine what the impact would be in Maryland and Virginia of D.C.'s decision, but also to gauge what the public interest actually is in those two jurisdictions. We expect some kind of opinion or announcement from the Virginia commissioner actually next week, and something from the Maryland commissioner further on down the pike. But my hope is that ultimately the three jurisdictions will be working together to determine how best to spend down this money in a way that both protects the company and serves the public interest.
Will D.C. have to wait until there is agreement from the Maryland and Virginia commissioners, Commissioner Redmond in Maryland and Cunningham in Virginia? Do they have to agree that our commissioner was acting within his authority and under the law?
No. He has the authority under the federal charter of the D.C.-based portion of CareFirst to ultimately determine how the company is to be regulated, and that includes how its surplus is to be spent. But even though he has that ultimate authority, I believe that both he and the other two commissioners want to work this out together if they can without having an interjurisdictional dispute.
Mm-hmm. Bill, you wanted to address
Walter,
a few questions to Mr. Smith.
Walter, I just sort of have a general question where our public could put Blue Cross Blue Shield into perspective. I was born in the D.C. area, and my father, who worked for the federal government, had coverage through Blue Cross Blue Shield. And I believe back in the 50s, Blue Cross Blue Shield was the largest insurance carrier in the whole D.C. area, and they were the largest coverage of federal employees. That being said, now I understand that the CEO of Blue Cross Blue Shield makes mega bucks, big bucks. Is that true? And could you give our viewing public an idea of just how much money this person makes and how that relates to how much money people should be getting back?
Well, I don't know exactly how much money he does make. I understand it is quite a lot of money, but to respond to your first point, CareFirst is by far still the largest health insurance company in this region, and it has been for quite some time. And something the public should understand is that the assets of this company actually belong to the public. And it may be that through the scrutiny that's now going on of the company, some people may inquire into the issue that you are raising, which is, if this is a charitable and benevolent not-for-profit, is the money that it's using to pay its executives being well spent in the public interest?
Well, how are these surplus revenues accumulated? Is there some sleight of hand involved here, Walter, or is this completely above board? I mean, is there some trickery that the consumers and subscribers don't know about?
Well, no, the excess surplus, as determined by the D.C. Insurance Commissioner, can only come from two places. It can come from the premiums that are charged subscribers, and it can come from money that's earned on investment. But in order to have money to put into investments, you have to have money left over after you have paid all expenses from the revenue you get from charging subscribers. So at the end of the day, as the CEO of the company testified at the hearing before the D.C. Insurance Commissioner last year, if the company in fact has excess surplus, and he said that it did, it has to have come from overcharging subscribers, which means that it has money, part of which needs to, at the very least, now be given back to subscribers.
The CEO, Chet Burrell, of CareFirst Blue Cross Blue Shield, acknowledged in an open hearing that the surplus reserves that have been now determined as excessive are the result of overcharging subscribers.
Well, just to clarify, he, of course, denies that there's excess surplus. But he testified that if there ever were a finding that there is excess surplus, it can only have come from one place, overcharging subscribers.
Walter, if we were to ask what, for you, is the most important takeaway or issue that can be developed, of course, with additional information, but for the general public and our viewership, what should they understand most importantly about this conflict with CareFirst Blue Cross Blue Shield?
I think the thing they need to understand is that because this company is a not-for-profit whose mission is to serve the public interest, that the money we're talking about, this $268 million, actually belongs to the public.
A lot of money.
And they have a stake in the determination of how that money should now be given back to the public. And those who are interested enough to do so, I would invite them to contact the insurance commissioner in their jurisdiction, to contact elected officials in their jurisdiction and let them know that they care about how this money is spent and they want it to be spent effectively in the public interest in a way that invests in community health care needs.
I think we also want to mention to the viewers that for those of you who want more detailed discussion, more detailed information about this issue, you can go to Appleseed's website. Walter, can you direct them in their navigation to the website to get more information about the CareFirst Blue Cross Blue Shield issue? Yes, they can. If they just go on our website, dcappleseed.org, they can click right away on the CareFirst issue and find all the information they need to learn more about this and learn how they can get involved in protecting their own interest. Will Appleseed have a role in the public discussion in, I'm certain there are health sector organizations that can't wait to find out how this distribution will work. Will Appleseed have a role in developing the coalition or the public interest groups in pursuing this issue? Yes, we hope to, Sam. As soon as we know what the D.C. Commissioner is going to do about how he's going to develop the spend down plan and whether he plans to hold a public hearing and solicit public comment, we will do our best to facilitate involvement of a lot of individuals and organizations so they can make their views known. I want to give an example, Walter, that you might not have done, but among the subscribers is a small group plan held by Appleseed Foundation. And as I understand, from about 2008 through 2011, Appleseed's premium increased over 30%. This is a tremendous cost to individuals and small groups. Is this the kind of or source of the overcharges you think that led to the accumulation of those surpluses? Well, it almost has to be, Sam, because given the determination that there's excess of $268 million, and given what Mr. Burrell said, and we agree with him, it has to have come from overcharging subscribers. I mean, we won't be the only ones that may have been overcharged. I mean, we're just a drop in the bucket. There are lots and lots of individuals and small group plans out there which are in many ways the heart of the revenues for the company. And now that we know the size of the excess surplus, we also know that a good bit of it, maybe all of it, necessarily came from overcharging those people. For the moment, Walter, do you have a sort of scan of upcoming events or upcoming activities? I know that we're, Appleseed is following all the appeals, you're filing appeals and motions. Are there any events or dates that will help frame this issue? Well, the two most important things that are about to happen, I think, are the the Virginia Commissioner is due to issue something next Tuesday, March the 31st, giving at least her preliminary reaction to the impact of the D.C. decision on Virginia. And we're going to be very interested to see what she determines and where she wants to go. It's possible she will want to conduct another proceeding. So that's the first important thing on the calendar. The next important thing on the calendar, I think, is going to be some kind of order from the D.C. Commissioner reacting to CareFirst's failure to file a spend-down plan, and also potentially determining how he is going to proceed to develop a spend-down plan of his own and how he intends to involve the public in that determination. Thank you, Walter. Bill? Thank you.
Sam Jordan and from Healthcare Now and Walter from DC Appleseed, we want to thank both of you. And as the public can see, this is something that bears watching and being involved. I'm Bill Schickler with Media Watch on Hunger and Poverty, and we'll see you again real soon.
Thank you.
A concern in this discussion is, why would CareFirst accumulate excessive reserves as a matter of corporate strategy? Why would the company continue to accumulate surplus funds when sufficient coverage for foreseeable subscriber risks has already exceeded 7, 8, 9, even 10 times the millions needed? Conversion. Remember this word, conversion. In 2002, CareFirst petitioned the Maryland Insurance Administration to convert from nonprofit to for-profit status as the first step in a two-step acquisition plan. If granted, the conversion would have been followed by the second step, a very profitable acquisition of CareFirst by WellPoint Healthcare and California insurance conglomerate. Well, CareFirst is at it again, the inexplicable accumulation of excessive reserves. We call this plumping the pigeon. If the accumulated millions aren't being used to reinvest in community health, premium reductions, or operational demands, they may well be intended to make the company a candidate again for another two-step dance with a prospective buyer, where the first step is conversion. The winners in a conversion will be the corporate executives at CareFirst. CareFirst subscribers can only expect continued increases in premiums. We want CareFirst to comply with the Commissioner's order and the terms of its charter. Thank you. I'm Samuel Jordan, Executive Director of Healthcare Now in Washington, D.C.